Okay, our very first presentation for 2023 comes from the Ocean County Health Department. And the thing is with the health department, I feel like a lot of people simply don't know all the services that they offer, and you should know the services that they offer. So let me introduce to you Peter Curatolo. He is the coordinator of community health services. All right, Peter. Here he is.
Directly into the mic. Bingo. Thank you so much. No pressure, being the first presentation of the year. Thank you, Andrea. It's really it's an honor to be here, especially with my colleagues who I'll bring up in a minute. They do the heavy lifting at the department. So the Ocean County Health Department, we are, again, my name is Pete Curatolo. We are located right down the block. We're at 175 Sunset. That's our flagship. We have 6 different buildings here for service for you in Ocean County. It's really important that we come out and give the olive branch of service to our seniors. Our county has about 627,000 people, Ocean County. In the summer, that balloons to about 1.3 million on our holiday weekends, Memorial Day, Labor Day, really any of the weekends, especially if it's good weather. So our department is governmental. We work very closely with our hospitals, of course in great standing, Hackensack Meridian, one of several. And we're very glad to be here to support our seniors. Our seniors make up more than a third of our county populace. So we're over 220,000 seniors. We have, to the best of my knowledge, about 5,000 centenarians and about 19 to 20,000 octogenarians. So this is very, very important. So now you have folks in their 50s and 60s taking care of parents in their 90s. Fortunately, you have us. The Ocean County Health Department is the largest county health department in New Jersey. We're number 1 out of 21. And we're right down the street. We're usurped only by the state health department itself. So alongside of me, my colleagues, we do much. We have people that are extremely credentialed, registered nurses, alcohol and drug professionals. We run 2 animal facilities. And I'll go over just a sky level view in these next few slides of what we do. If something clicks with you, again, many thanks to Andrea, who's a wonderful executive director of SCAN, Mike Ciavolino. You're well served. We want to build this relationship. Virtually everything the Ocean County Health Department does comes at no cost. In fact, I should be prepared, but I can tell you with certainty that the only thing that comes to mind that I think of out of all of our services and all of our 225 employees that we charge for is a shingles vaccination and a seasonal flu vaccination. And generally the Medicare card will, you give us the Medicare card and that suffices for flu. We have about 50 different flu clinics available in most of our municipalities throughout flu season. So it's just one of many, many services. We are regulators. We can go out, we cite violations, but what's become very apparent and important to us over the years is if we have licensees along with robust enforcement to protect our public, food inspections. Under my supervision, we test all the water for the rec bathing. You come down from North Jersey or out west, you want to go to Seaside Heights or one of our other great, beach destinations, our folks test that water. We get it tested at the Ocean County Utilities Lab. So you have choices now in real time, and we want that quality control in place. But what we've really brought to the table in the last several years is education. It's that old proverb, and we're in a church, so I guess it's appropriate. You give a person bread they eat for a day, you teach them how to sow a field, and they'll never go hungry. Well, we do that, and I'm very proud of that. And so anyone that wants any education, a licensee, whether it's a restaurant or a hotel, lifeguards at a beach, people in our schools, we bring those services to bear, and we're very, very proud of that. So without being too long-winded, I wanted to introduce you. This is our building. It's right down the street, 175 Sunset. So the best way to navigate this abbreviated part of what I'll show you here is through our website. It's very easy, ochd.org. That's oceancountyhealthdepartment.org. Surf through, see what you need. We offer services for veterans, for seniors, for school children. We have dental grants that we partner with 113 different dental services for uninsured and underinsured individuals. And that's just the very tip of the iceberg. So we will move on. So here's where we're located. Toms River, Lakewood. NOCAF stands for Northern Ocean County Animal Facility in Jackson, Barnegat. SOCAF, Southern Ocean County Animal Facility in Manahawkin, and then in Manahawkin. And in Manahawkin, we also have a disaster preparedness group. And they just had great and spectacular outreach, robust outreach to every part of our community during Sandy. So we have a gentleman down there, Dr. Mukesh Roy, one of many great colleagues that serves in our Army National Guard. And he really was one of the spearheads for our COVID response. We did over 100,000 vaccinations for COVID during this pandemic that thankfully we are coming out of. So the health department divisions, the aforementioned animal facilities, clinic services, communicable disease, community health assessment, which is an important part of public health practice standards, early intervention, environmental health, health ed, which is an integral part of what we do, special child, substance abuse, addiction, and opiate dependency, and women, infants, and children. So we have the largest WIC department in the state, and therein are diabetes professionals, nutritionists, dietitians, registered nurses. We serve about 18,000 families a month through our WIC department alone, so it's a real value add. So our animal facilities, if you're looking for a pet, we've got that covered. We can help you adopt a pet. We have pets that are microchipped and vaccinated, dogs and cats in both NOCAF and SOCAF, and we're only too happy to do that for you. You can come out. We have ACOs on staff, that's animal control officers. So we don't give you a pet that's aggressive. These pets are all temper tested. These are good family pets, and we want to try to find them their forever home. Now, because I'm 54, my glasses. A little bit better. Let's see what we got here. Our clinic services. Registered nurses really make it all happen. Virtually every night or every day, our nurses are out in the community. Whether it's an STD clinic at 175 Sunset or an outreach for finger stick glucose and blood pressure at a senior facility, whether it's working with all of our school nurses and even 143 fluctuating list of preschools. We want to have a presence with our nurses and our health educators in our community, and in particular for prevention. Health educators go out and they're talking about things like hand washing, health, hygiene, integration into curriculum. Another real value add for teachers, guidance counselors, administrators, and of course students. Communicable disease, a very important unit. Credentialed people right down the block have kept an open line of communication with our superintendents, our senior clubhouse presidents, of which I believe there are 79 different clubhouse associations in Ocean County, heaviest concentration of seniors in the state. So these folks are there, they're a brain trust. They've helped keep us safe, establish protocols, work with information coming down from the CDC to disseminate throughout every part of our community, from our seniors to our school children. They do yeoman's work. Community health assessment. In particular, this is what I do. So in a nutshell, we have to be able to serve. I can't just come out here and tell you, we care about diabetes, we care about heart health, access to care. This is a very deliberate list that came about through a very deliberate and purposeful process called the Community Health Needs Assessment. We have 5 different groups, one representing each one of these 5 health indicators, and then our partnership for a Healthier Ocean County, PHOC, which is our steering committee. With their help and my oversight and my colleagues, we develop these health indicators, and I have to be able to produce quarterly real progress. How many clinical touches have we made? How many pieces of education have we disseminated into the community? Has it gotten any better? Have we transitioned people into more dental care, into more health care? Have we helped our seniors, our school children? And I have to be able to measure that. And so that comes out in an annual update each year, right around this time. Health education. My good colleagues over here, they say, for every dollar you spend on education and prevention, that's $5 to $8 you don't spend on treatment or a hospital stay or an inpatient stay for drug and alcohol abuse or other related mental health issues. And it's really important because colleagues like to my left, they're out there, they're in the community, they're adding value, they're preventing disease, they're preventing addiction, they're working with our superintendents. So I'm not sure that other health departments do that at this level that we have here with these great colleagues, but I know that we do it, and we're all very proud of it. And that my colleagues will be up shortly to talk more about that. And we do need to invest in a clicker, because that would help a little bit. I gotta watch, it's a hot mic. Our early intervention program for infants, if child special needs and identified as such, we have colleagues right here at 175 that work with the schools and transition those children and those families into the appropriate milieus for care. And they take care of everything, the whole care continuum. It's very important work that they do. And we're starting very early with children in preschools, and we go up and we offer service corridors for everyone in the middle, and including our seniors and later on in life. Environmental health, a very important part of what we do. There's about 7,400 licensees of just restaurants, hotels, and the like, mobile units that serve food. We have what we call REHS, Registered Environmental Health Specialists. They're licensed by the state of New Jersey to go out, do these inspections. But they don't just go and write violations. They're extending education through HACCP program, HACCP, which is Hazard Analysis Critical Control Point. It takes care of food from the point of delivery to preparation to hot and cold holding to plating right in front of the customer. Merchants love when we go out and educate our licensees because it's an easy sell. Fresh food, safe food is food that tastes better. You sell more of it. So septic, sewer, noise complaints, youth camps, training, tanning facilities, and also tattoo parlors, all covered by our registered environmental health specialists and our EHSs, our environmental health specialists as well. Live Healthy Ocean County. This is a fabulous program. Yeah, there. Yeah, like I said, clicker. Registered nurses go out, diabetes colleagues go out, licensed diabetes educators, nutritionists, and they do Live Healthy Ocean County. And what we've done is we wanted to expand the footprint of public health. So we want to go to non-traditional places. We were just at a large group of car dealerships down at exit 63 on Route 72. The gentleman had a little over 200 employees. Our Live Healthy Ocean County folks went down there, and folks that would never be exposed to public health now got finger stick glucose, cholesterol, bone density, a variety of different points of education through brochures, follow-up if they wanted, nutritional counseling. It was a value add. Why did the merchant like it? Because if you're healthy, you use less sick time. People are at work more. It's regardless of your business model, we're there We're providing this service, and it's a real value add. Again, I keep saying value add because that's what my colleagues do. I just talk behind the microphone. They do the heavy lifting, and the businesses appreciate it. PHU2, Public Health is U2. It's a younger version of our website, ochd.org, and it's really geared to get some of our younger people who are very tech savvy and on their devices all the time, and just to get them a flavor of the public health outreach that we have and the availability of our programs, and it's worked well. Social media, our public information officer has been very above board in this regard. They reach out through our social media website. So everyone involved in the CHIP, in the Community Health Improvement Plan, and Live Healthy Ocean County, you know, we promote each other's programs. Nobody works in a silo. We know what each other is doing. And somebody says, hey, Pete, you know, I have this program and it's over in the church on Church Road at St. Andrews. Well, let's get it out on social media. Let's grow it. You know, the more touches we make, that's our only horse in the race. We don't get compensated by you know, there's no incentive structure. We're here vested in public health, and that's what our mission is. So without anything further, I think I have one more slide that shows our contact information, and then I will have this here I'm going to email this whole presentation out to Andrea and Mike. So they'll be able to share it freely. Special Child Health, again, a dovetail with our early intervention program. So they work well together, and they're able to bring the services to the schools. Not to be overlooked, substance abuse, addiction, and opiate dependency. We have a wonderful department head over there named Kim Riley, who's really grown that department well. Amanda, that's Andrea. Amanda is an integral part of that department out there. They're doing fatality reviews, what they call social autopsies. I don't want to steal any of her thunder. I'm going to have her ask her to come up because it's not only new, it's cutting edge, and she brings it out to the people so that we can bring prevention through heat maps and technology, things that other areas just don't have. And we have it here in Ocean County, and they use it so well. I talked a little about WIC, about 18,000 families a month. This is, you know, folks that are eligible. It's a federal program. It's administered by us. And at our WIC in Lakewood and our WIC in Toms River, when it was first opened up about a decade ago, I went there, I took pictures of it. And my understanding is our WIC department was recognized around the country as a model WIC department. You walk in there, it's inviting for families, it's inviting for children. It almost looks whimsical, like a playroom in nature, but it's completely clinical, and the folks there are very highly credentialed. So again, I use the phrase value add. Our COVID-19 response, there was no shortage of partners. I mean, we had our hospitals there, we had our WJ, we had registered nurses, volunteers, the Indian Physician Association. Everybody had a piece of rope in that tug of war, in that fight. And I'm glad to say it looks like we all came out ahead. This is some of our contact information. The take-home point is the website, ochd.org, and 732-341-9700. Tell the good people on that end of the phone when they pick up what you want, and they'll transition to you to the appropriate department, one of the 225 of us. And I really want to bring up my colleagues, if they want to say just a couple of words. Maybe I'm embarrassing them now, because as I'm recalling, they did not want to come up, but they deserve to be recognized as they do such great work. This is Amanda Gann from our opiate department. Amanda. And Sue Heil, a registered nurse, a wonderful program that she has spearheaded. And like I said, again, the value that they add, the counseling that they offer, really novel. And the way that we expanded, the way that they've expanded it. So without further, Amanda.
Thank you. Hello, everyone.
Can I ask a question?
Sure.
We're from Monmouth County, and we don't have the similar things. Is there a way to get any information from Monmouth County for people to
Yeah, I would probably contact the Monmouth County Health Department or Monmouth County's Department of Human Services. They probably would have more information for you on their specific services. Yeah, absolutely. But good afternoon, everyone. My name is Amanda. I am a program development specialist in our Department of Substance Abuse, Addiction, and Opioid Dependency. And what I do is I monitor overdose statistics in Ocean County. As we know, the opioid epidemic has really taken a significant toll on really every aspect of our community, and every family has been impacted in some way. So what I do is I look at overdose spike data from local law enforcement as well as our hospital admissions, and I am looking for spikes in overdose data. So when we see high numbers of spikes, I'm working with our community partners to implement strategies to reduce overdose from happening. As Pete was saying, you know, prevention is so important, and when I was in my graduate program, one of my colleagues said an ounce of prevention is worth a pound of gold. And that saying has really always stuck with me since then. We actually have our table over here that has some prevention materials available to you, so prevention can start right here, right now. We have Deterra bags, which are at-home disposal kits, a safe way to dispose of medications at home. So if someone has, you know, unused, unwanted, expired prescription pain medications, we have a way to dispose of them safely and keep those medications out of our water system. And the pouches deactivate the medication so they're no longer good to someone that might get their hands on them. And we have Sue here as well, who is our arch nurse. She's going to talk a little bit about the services that she offers.
Thank you, Amanda. Hi, I'm Sue. I usually don't need a microphone. I can be quite loud. My program is called ARCH, Access to Reproductive Care and HIV Services. And basically, today, one of the things, everything I offer is absolutely free. So all kinds of testing services for anybody that wants STI testing, HIV, hepatitis C, pregnancy testing. I have a counselor who's out on maternity leave, but where else would you ever get a free session to counsel with somebody? And the goal of my program is to address all the stressors of people as they're growing up that may lead to alcohol and drug abuse. One of the things I also do is I train and give out for free Narcan kits to save a life. Now, some people think this doesn't really apply to me, but if anybody's ever gotten a prescription from their doctor for any kind of opioid, so your Percocets, your Vicodins, even narcotics that are in cough medicines, these can all lead to an unexpected overdose. So the doctor is actually supposed to give you a script to bring naloxone or Narcan, to have it in your home, whether it's for your spouse or someone else, or maybe a grandkid's visiting and they pick up something and take it. It'll save a life. And so basically, that is the goal of the problem. It's all a lot of preventative things. And come over, and we have a list of our services and my brochure. A lot of people who want Narcan in their home, they want to talk about it privately, because it's people we love and care about a lot of times. And sometimes it's friends and family members that you're concerned about. So if you get trained, you have it, you use it, I replace it for free. If you take your script to the pharmacy to get your naloxone, they'll say thank you so much. It's like $130 if you're not, if it's not covered. Free is the word. So come on over and just see what we have, and at least take my pamphlet so you can contact me, or give it to a daughter, a son, grandkids that might want to have some free services available to them. Okay? Thank you so much.
Just want to close with saying thank you and open up the floor if anyone had any questions that I could answer or help transition them into our department. Okay, I want to thank Andrea so very much, and Mike again for the invite, and certainly you'll be here next month. Thank you very, very much, and please visit our website, ochd.org. Thank you, it was an honor.
Thank you, Peter.